Good afternoon, everyone. Welcome. My name is Zach Sherman. I'm the Executive Director of Pennie. Big thank you to the United Way for inviting us to be here today to share a little bit about who we are, what we do, and what's going on. I'm joined today by my colleague, Scott Yeager, our outreach manager here at Pennie, and between the two of us, we're gonna share a little bit about the program, our recent open enrollment period, and new things that are coming up. And I've already forgotten to do the one thing I was supposed to do, which is to say at the top, this session is being recorded. So we just wanted to make sure that you're aware of that. So again, thank you to the United Way. And with that, I'm going to jump into the presentation. And I'd like to start at the beginning. Where did Pennie come from? What is our origin? Pennie was created by a bipartisan piece of legislation that passed both chambers of the General Assembly in 2019 and was signed into law by Governor Wolf in July of that year. This piece of legislation, which created Pennie, was so uniformly supported across the board because it did a lot for the Commonwealth. It brought a lot back to the Commonwealth and cost us no additional money to do so. And very specifically, it created two programs through the legislation. One was the transition to Pennie, a state-based exchange, from Healthcare.gov, the federal exchange, with a requirement that we improve customer service, that we expand access to coverage, that we connect to more Pennsylvanians in need of health insurance, and that we do it in a way that is efficient and saves the state money. That last piece was very key because those savings were specifically earmarked for funding the state's share of the other program, which is a reinsurance program. It's called a reinsurance program, and it's intended to reduce the cost of health insurance in the individual market where we operate. From what it would have been in 2000, from what it would have been had we just stayed the course with Healthcare.gov. So that's how it came to be. The whole intent was to do more for Pennsylvanians, expand access to coverage, reduce the cost of health insurance, and to do it in the most cost-effective way. And that's why it was so resoundingly supported. Here on the screen, we have a picture of the signing of the legislation, which was, it's worth calling out that Speaker Cutler was the prime sponsor of that legislation, and this is a representation of how uniformly supported this idea was, this program was, and you know, huge credit to all the leaders, including the governor and the speaker who made it happen. So that's how we came to be. Fast forward about a year and a half, and we're in the fall of 2020, and we've transitioned from Healthcare.gov, and on November 1st of that year, we opened our doors as Pennie and started our first open enrollment period. We launched with a goal of improving the accessibility and affordability of individual market health coverage for Pennsylvanians. We do this by being the official marketplace for the Commonwealth. We've replaced Healthcare.gov. If you go to Healthcare.gov today, if you type in your zip code or let them know where you live, they'll automatically redirect you back to our website, to our call center. We are very importantly the home for high quality, affordable health insurance plans, and very specifically the only place you can go to get financial assistance to reduce the cost of individual market health coverage, reduce your premiums, in some cases, reduce your out-of-pocket expenses. We exist to serve and help individuals and families who don't have access to coverage through some other means. So people who are uninsured, people who are without access to job-based coverage, people whose income is too high to be eligible for the state's medical assistance program, or people who are too young to enroll in coverage through Medicare. So that's where we come in. We provide unbiased assistance. We provide financial assistance to help people enroll in coverage. And we work with the Department of Human Services to make sure that people, regardless of where they start, whether they're applying at the Department of Human Services or whether or not that they apply through us, that if they're eligible for either program, so if they come to Pennie but are eligible for medical assistance, that they ultimately get to the right place to get covered. And that works both ways. If someone goes to GHS but is eligible for our program, if they apply there, there's a pathway over to Pennie to get covered. So as I briefly mentioned, we have a number of tools to help people navigate the process along the way. We have dedicated online self-service tools. We have a dedicated call center. We have partnerships with community-based organizations, nonprofits to provide navigators or assisters. These are folks that you can get connected to through us or directly, and they can sit down with you either in person or virtually to help you navigate the application and enrollment process. Similarly, we have partnerships with thousands of licensed and certified insurance brokers, and they are also trained on the program and the platform, and they are capable and allowed to give advice on plan options, and they're actually the only ones who are legally allowed to provide plan advice. And so if you're looking for that sort of assistance, we can connect you to a broker. Next slide, Scott. Just wanted to cover very briefly that all of the plans available through Pennie are required to cover, are required to be comprehensive, are required to cover the core set of essential health benefits, of which there are 10. And they're all listed on the slide, but inpatient, outpatient services, emergency services, prescription drugs, behavioral mental health, substance use disorder services are a number of them, and the plans are required to cover these. And a couple other consumer benefits include that you cannot be denied the ability to enroll if you have a pre-existing condition. You can't be denied the ability to renew into coverage if you experience some sort of pre-existing condition or illness while being enrolled. And individuals under 26 can remain on their parents' plans. We have a number of participating health and dental insurers across the Commonwealth, and they vary based on where you live. But the medical insurers include PA Health and Wellness, Capital Blue Cross, Cigna, Geisinger, Highmark, Capital, Independence Blue Cross, Oscar, and UPMC. The dental insurers, of which there are a number, are also listed on the slide. So last thing I'm going to cover before I hand it over to Scott is just who are we trying to reach? Where do the uninsured live across the Commonwealth? And what you're looking at is a county-based map of the uninsured. The darker the blue the county, the more uninsured people live in it. A couple traits about the uninsured: they tend to be more concentrated around higher population areas, which is no surprise. The uninsured tend to be lower income. They skew more likely male than female. And a number of them, the majority of them, are eligible for financial assistance that we provide or no cost coverage through the state's medical assistance program. And there's a large number that we've come a long way reducing the uninsured across the Commonwealth with the expansion of Medicaid as well as the launch of Pennie. But there's still more work to do, and we're eager to secure anyone's help to get the word out and to connect with those that are uninsured to help them get covered. So now I'm going to hand it over to Scott, who's going to talk about how many people signed up in our most recent open enrollment period, as well as how the American Rescue Plan has expanded access to coverage and financial savings across the Commonwealth.
All right, thank you so much, Director Sherman, and thank you again, everyone, for joining us today to learn a little bit more about Pennie. And there was a question that was dropped in the chat. Please feel free as we move through this presentation. If you have questions, know that we're monitoring the chat, and we will do our best to answer your questions. If for some reason there's something that we need to look into, we'll be happy to look into it and provide you with information afterwards if you provide us with your contact information. So with that being said, Pennie just completed its second open enrollment period. And when we first launched Pennie back November 1st of 2020, we migrated about 280,000 customers over. I am very, very happy to share with you the fact that there are 374,000 plus Pennsylvanians who are now protected. That is a figure that we worked very hard for. And there are a lot of perceptions that we're trying to change about being protected and about health insurance in general. You'll also note a couple interesting things on this slide. Number one, 58% of our customers right now are automatic re-enrollees. Our retention of customers, knock on wood, has been very good. And with regard to active re-enrollees, one of the things that Director Sherman mentioned is that the legislation that established Pennie attempted to do so with the notion of Pennie being a competitive marketplace here in Pennsylvania, giving individuals the opportunity to shop different plans, to compare different plans. And again, that's a work in progress. That's something that we will continue to do as we move into the future. But for right now, 24% of the customers who were with us were active re-enrollees. Those were individuals who were shopping for new options, and more on that here in a second. But we also, 18% of our customers coming out of our open enrollment for 2022 were new customers. And that really brings a lot of excitement to us, because that's what we're here for. We're here to make sure that folks get protected. One of the things I'd like to call out here is that 90% of our customers at Pennie are eligible for some type of financial assistance. One of the biggest barriers that people face when it comes to health insurance is addressing the question, can I afford it? With Pennie and through the American Rescue Plan that we'll take a look here in a second, it most definitely is a historic time for us to be in a position to protect our friends and neighbors here in the Commonwealth. The average monthly premium savings that we have here at Pennie coming out of open enrollment 2022 is $449 a month. That's significant. You can also see through our metal tiers that we have bronze, silver, and gold. And it's nice to see that our customers are in a position where they have access to not only quality health insurance, but they have the ability to afford good insurance. So we're doing our best to make sure that individuals here in the Commonwealth of Pennsylvania are aware of not only Pennie, but the American Rescue Plan. And as you may know, the American Rescue Plan was signed into law by President Biden on March 11th of 2021. What's significant about this is that for 2021 and 2022, it provided improved access to coverage and care by way of more generous tax credits at every level of income. It removed the subsidy cliff that existed at 400% of the federal poverty line. In other words, prior to the American Rescue Plan, if you were an individual that made $51,000 a year, you'd be in a position where you could shop on the marketplace for insurance, but you wouldn't necessarily qualify for health insurance or for financial assistance. It's the same way with a family of four who were at 105,000 or more. The good news is that we're in a position now where under the American Rescue Plan, we can cap the premiums at no more than 8.5% of the household income over 400% of the federal poverty line. And I'll have some scenarios here in a second. The one thing that I want to stress to everyone here is that through 2022, these savings are still in force. So it's incredibly important that if you know someone who's uninsured, now is again a historic time to receive assistance. So the first scenario that we have here, and I have a few that I'd like to share with you. The first scenario is a single individual. He's 40 years old. He makes $19,140 a year, roughly 150% of the federal poverty limit. Prior to the American Rescue Plan, this individual would have paid about $66 a month for Pennie's second lowest cost silver plan, what we call our benchmark plan. Now, under the American Rescue Plan, this individual would qualify for $0 premium. And that is a significant savings, about $792 a year. For someone who makes $19,000 a year, saving $800, that's a big deal. But here's an even more significant measure of the savings that are available now. Many of us have friends, family members, people that we know in the community who have done everything right. They have worked hard, they have set aside funds. They may retire a year or two early, or they might decide in their career path that they're going to become a consultant, okay? For individuals, older individuals in our communities, health insurance can be very, very expensive. But if you take a look at the scenario here, you have a couple, okay? They're 64 years old. They both make combined $77,580 a year. Now, prior to the American Rescue Plan, this couple would have paid, and this is not a typo, they would have paid about $2,462 a month for their health insurance. That's a big deal. If you take a look at where they're at now under the American Rescue Plan, individuals and couples like this would now, making that $77,580 a year, they would pay about $550 a month. The good news is they would save nearly $23,000 a year. Now, that is literally life-altering for individuals who are on a fixed income, who are heading into what should be very carefree times. So the savings that we're providing is substantial. A more common scenario are individuals who may have a family. And in this case, we have a family of four. Now, prior to the American Rescue Plan, this family of four, again, for our second lowest cost silver plan, would have been paying about $285 a month to cover four people, okay? That's not too bad. However, under the American Rescue Plan, we are now in a position where we can provide the same family of four, the same insurance for $87 a month. That's a little over $20 a person to cover four people, saving this family about $2,300 a year. So there's a lot of good news that we have. And part of that good news is a lot of individuals, when they think about Pennie as Pennsylvania's official health insurance exchange, the focus tends to be on open enrollment. And from November 1st to January 15th, people think that after that, on January 16th, Pennie vanishes and goes away. Well, that's not the case. Pennie has special enrollment period. Now, that special enrollment period literally spans from January 1st to December 31st through 2022. Now, we still have, and we are looking forward to our third open enrollment here in Pennsylvania, November 1st of 2022 to January 15th of 2023. But during 2022, a special enrollment period exists that outside of open enrollment, Pennsylvanians have the ability to change a plan. If they have a qualifying life event, if they have a qualifying life event, and we'll cover those here in a second, they have the ability to enroll in coverage. And that is incredibly important, especially if people lose their job. If people qualified for Medicaid, but now they don't. Or if you have individuals who have changing life circumstances that we're going to take a look at in greater detail here in a second, those qualifying life events will open up a special enrollment period during 2022. And the savings by way of the American Rescue Plan, still there for them. This is a list, and we've categorized these under 4 banners for you to consider. Again, this is not necessarily an exhaustive list of the qualifying life events, but it's a good representation. The first you see here is a loss of coverage, and that could be any number of things. Losing your employer-based coverage, losing a student plan, losing access to Medicaid CHIP or Medicare, turning 26 and losing coverage through your parents' plan. That's a qualifying life event. We also have circumstances where you might have a change in household. If you know someone who's getting married or divorced, having a baby or adopting a child, or unfortunately, if there's a death in the family, and they lose their coverage, don't hesitate to refer them to Pennie. That's what we're here to help. Meredith, that is an incredibly good question. We just got a question about how do CHIP and Pennie interface. Director Sherman had mentioned that as a Commonwealth agency, we have a very good relationship with the Department of Human Services. And by way of that, we have a no wrong door policy. So if you refer someone to Pennie initially, and it's determined that that individual qualifies for Medicaid or CHIP, we actually have a warm transfer process to the Department of Human Services to make sure that they get the protection that they need. So that's something, again, that because we are here in the Commonwealth and we work alongside of all the other Commonwealth agencies, that's something that in our initial launch, during our inaugural launch, that was something that we were also very excited to be able to share with Pennsylvanians, is the fact that if you qualify for Medicaid or CHIP, and the adverse is also true. Director Sherman's going to talk a little bit about that here in a second, but we also get referrals from the Department of Human Services. So communications are strong there. In terms of, and thank you again, Meredith, for that question. In terms of the special enrollment period, again, you could have a change in residence. A lot of people don't know this, that if for some reason, let's say you have a new job opportunity where you go from Pittsburgh to Erie or from Scranton to Philadelphia, you find yourself in a position where you change healthcare markets. And that alone is an opportunity for you to reach out to Pennie, okay? Also, and this is another important thing, if you move from another state to Pennsylvania, or if you're a seasonal worker, or if you're, moving from a shelter or you're in transition, those are all factors that open up that special enrollment period by way of the qualifying life event. And there are other qualifying life events available to folks here as well. Everything from gaining a qualifying immigration status to leaving incarceration. It's, again, this is not an exhaustive list, but if you have a doubt as to whether or not a life circumstance would qualify someone for a special enrollment period here at Pennie, all that you would ever need to do is direct them to Pennie.com or have them call us at 844-844-8040. With that being said, I'm going to turn things back over to Director Sherman, and he's going to update you on some very exciting developments.
Thanks, Scott. Moving to the next slide, we wanted to highlight a new opportunity for folks to get covered through a special enrollment period through Pennie, and that's what we're calling a low-income qualifying life event. This is an opportunity for people with household income at or below 150% of federal poverty to come in and get covered, as long as they otherwise qualify for the financial assistance that we provide. Through the application process, if they meet those qualifications, the applicant will automatically be eligible, will automatically receive the special enrollment period. And it's currently available as of yesterday for new customers applying for coverage through Pennie. So what does 150% of federal poverty mean? We have, to make it a little bit easier to follow, we have that household size and associated income listed here on the slide. An individual with income at or below $19,320, or a family of four with income at or below $39,000 will be eligible to receive this new qualifying life event, which will allow them throughout the year to apply for and enroll in coverage, even if it's outside of open enrollment. Another thing worth highlighting is that this will be available to those lawfully present immigrants who are below 100% of federal poverty and ineligible for medical assistance. So this is an opportunity for someone who is lawfully present in the state, in the country, very low income, and ineligible for medical assistance because they haven't been in the country long enough. Those applicants will be able to take advantage of this opportunity, get covered through Pennie, and receive the maximum amount of financial assistance that we provide. Another initiative that is new and upcoming that we wanted to highlight for you here today is a program we're calling Path to Pennie. This is a program that we've done in partnership with the Department of Revenue, which is specific to uninsured tax filers who indicate on their tax return, their state tax return, that they are uninsured and interested in getting covered through Pennie. If someone goes through that process, if they are filing their taxes, they're uninsured, and they indicate as much on this new tax form called the Health Insurance Coverage Information Request, they will be connected with us. Their information will be securely submitted from Department of Revenue to us. We will take that information, create an account, create an eligibility estimate of what that family, what that individual will be eligible to receive in terms of financial assistance. And we'll send them a communication letting them know that they have 60 days through a new tax filer special enrollment period to come in and get covered through Pennie. So this is a unique program. It's a new opportunity. It's a great partnership between us and the Department of Revenue to connect uninsured tax filers with coverage through Pennie outside of open enrollment. It's worth noting that this is a very brand new program, and that form is available through the tax filing process right now. We won't formally kick off the noticing and communication process that I just described until the beginning of April. So if someone is filing their taxes early and fills out that form, they can still avail themselves of this opportunity. They just need to give us a call directly at our call center in the interim period before April. So the last slide we have here is just to reiterate the different types of personalized local help that we provide both in person and virtually. We have a dedicated call center. The phone number and open times are available at the bottom of the slide. We have the ability to connect you to a broker, to an assister, and there's an ability for you to ask and get your questions answered online. We are we're super grateful for the opportunity to be here and to share a little bit about who we are and the different initiatives we have going. At this point in time, we are more than happy to answer any and all questions, including Meredith. I believe you had a question about navigating the process. You're more than welcome to ask that question here, and if we can answer it, as Scott mentioned, we will. If not, we'll follow up.
Okay, my question was, I had a parent who was insured through Pennie, and the children had health insurance they had MA through the other parent in another state, and we're now living with the parent in Pennsylvania. And so I assisted them with applying for CHIP. Last I heard, they were still waiting to hear if they were approved, but some time has lapsed. So I didn't know if, with him being involved with Pennie, if that should go through smoothly or.
Got it. Yeah. So applying, do you know if they applied through Pennie to CHIP or if they applied directly with CHIP? Either way, there is a period of time, generally speaking, where those applications are processed, and we connect people to the CHIP program through the process of sending their applications over there. We are not directly responsible for administering that program, so we wouldn't be able to answer specific questions. We can certainly facilitate the process of getting connected, but if you have a specific question about the status of a CHIP application, the best way to check on it is to contact them directly.
Okay, thank you. My question was more, in theory, it should be okay to do it
Yeah.
that way. So,
Yep.
Okay.
That's correct.
And Zach, I saw that Angela had a question about how to connect with Pennie agencies in her area. And if it'd be all right, everyone, you should see Pennie.com, which is our website. We're very proud of it. One of the easiest ways to connect with Pennie is up here in the upper right-hand corner. You'll see 844-844-8040. We also have our support and connect tab here, that if you click on that tab, you'll be in a position where you can literally click to call if you would like to give us a call, if you're on a mobile device, obviously. You can also find a broker. And Angela, thank you. That's part of the reason why I had asked for your zip code is with one click here, you can actually go through and search Berks County. The zip code, I'm just going to put 5 mile distance. You can also select different languages here, by the way. And if you click search after entering your zip code, you'll see all of the Pennie certified agents relative to the area that you live in. In this case, there are 18 agents that are found within Berks County that are within a 5 mile radius of 19601. And again, some have, we list contact information, their specialization, some are health, life, Medicare, property casualty. Some have different languages listed on their profile. But I mentioned that also to share with you, as Director Sherman mentioned earlier, that we also have Pennie certified assisters who work through hospitals, health centers, community centers throughout Pennsylvania. You can also search for a Pennie certified assister the same way. Now, the one nice thing about our assisters is the assister network, they're unbiased. They're there to make sure that people get protected. They are a significant resource in our communities. And as you can see, there's 5 organizations, Berks Community Health Center being the most prominent in your area, but also Penn State Health. So hopefully that answers your question. And with that being said, I'd also like to just again thank everyone for providing us with an opportunity to share some information and updates with you about Pennie. If you have any questions, do not hesitate to reach out to us here at Pennie.com. Thank you again so much, and I hope everyone has a peaceful day.